Oh, hi there. It has been 9 weeks and a day since Cindy had her total knee replacement surgery, and we thought we would come back and give you an update. And by we, I mean Cindy. So, how's it been going?
Oh, great. Just great. Better. It's definitely been going better. So I do have a notebook here that I'm going to be referring to because I made some notes on some things that I wanted to be sure and mention. So since our last update, if you haven't seen that video, go watch that video. We did that at 4 weeks and things were still pretty tough. They were still definitely pretty tough. So since that last update, I've stopped using the walker. I stopped using the walker at 5 weeks. I just decided I'm done. I need to get over this. And I ordered a cane on Amazon and I got me a lovely little green cane right here with 3 feet on the bottom. Really like that. It stands up all by itself. So I started using that at 5 weeks and I used it for about a week. During that 5 week time, I got very sick. I mean, we even went to the doctor and was tested for the flu and COVID, which it was neither, but boy, was I sick. I was sick for a good solid 5 days and it was rough and I was really worried it was going to set me back, but I pushed through and did all my PT anyways. I did cancel going to PT, I think, that week because I was sick. Made it through that, thank goodness. I was supposed to go to a 6-week post-op,
Right.
but we canceled that and went to the doctor instead. So it was 6 weeks and 3 days when I went for my 6-week post-op visit. And we saw the nurse practitioner because I don't know about you, but my surgeon is very elusive. You meet him one time before surgery, and he's kind and nice and wonderful and has all the time in the world for you to answer any of your questions. In hindsight, I wish I knew what questions to ask, but I didn't. I just mostly asked, "Are you really going to cut my knee off?" And then I saw him the morning before surgery when he came in and autographed my knee, so he knew which one to work on. And then I saw him right after surgery when he threatened me that if I didn't get it bending, he'd do it for me, meaning an MUA. And we didn't get there, thank goodness. If you don't know what that is, that's a manipulation under anesthesia. If you don't get your leg bending according to what your doctor thinks it should be bending by a certain amount of time, and I say that because all doctors are different. Some you go in at 4 weeks, and if you're only at 70, they say you've got time, you're fine. And some you go in at 4 weeks, and if you're at 90, they say that's not good enough. We're going to do an MUA. So I saw him after surgery, and then I haven't seen him again since. My first 1 week post-op was the physician's assistant who helps him in surgery. And then the 6 week was the nurse practitioner, but she was really, really nice. We really liked her. She just kind of came in the room and she started checking off all the boxes to where I am at this point. And it was, yeah, she was right. I was doing all of those things. I had requested an x-ray for that visit. The doctor didn't request one. They did for the first week post-op. I needed the peace of mind. I needed to know that this fake thing in my leg is where it's supposed to be and that this crazy pain I'm having is not because something's wrong with it. I needed peace of mind. And fortunately, when I called and told them that, the gal that I talked to, she says, "I totally get it." She says, "That is totally understandable." So I was really grateful for that. So I had a x-ray and the nurse practitioner looked at that. She said, "Yep, everything's fine." I said, "Is my kneecap okay? Is it in the right place?" And she said, "Yes, it is," because I'd been having some issues with my kneecap where it just felt like something was snapping. I know I hear a lot of people talk about clicking. They can hear the prosthesis clicking, and everybody says that's normal. But I felt like something snapping. It's my left leg, so it was on the outside, kind of down below the kneecap, and every time I would bend my knee as I walked, it felt like something snapped, and it like snapped against my kneecap. And it got to the point that it hurt so bad, and it was even painful to touch that area. I didn't want to walk anymore, and I certainly didn't want to try bending my leg when I walked. Now, I could still do my flexion exercises. I could still bend my knee and do heel slides and stuff, and it didn't do that then, only when I walked. And if the room was nice and quiet, you could hear it snapping. And so it had just started doing that at that 6-week appointment, and I told her that, and she said, "Well, all these things like to ride in their own little groove, and with swelling and stuff, it gets things kind of out of their groove, and so it's nothing to worry about, and as the swelling goes down, it'll be fine." But it just, after that appointment, it just got worse and worse, and it just really bothered me a lot. But anyway, I'll talk about that again in a minute. So then we talked about me still using a cane because I felt like I was a bad student. I was a bad patient because I'm 6 weeks and I'm still using a cane because I was comparing myself to all the people who, didn't ever use a walker or a cane, or, they only used it for a week or whatever. And so I was just in that rut of comparing myself. And she said, it's fine. It's absolutely fine to use it. But she did want to watch me walk, and then she had me hold my cane, and she says, I feel like you do better without the cane. She also told me that at this point, she said, what all you should be doing, and she was happy with my flexion and my extension, which was 0, and the flexion was 121 at that point at 6 weeks. She was happy with that, but she said, all you really need to be focusing on at this point is your flexion and your extension. She said, whenever you're sitting down, if there's a table or a desk or something in front of you, put that heel up there, let that leg hang straight, work on that extension. And when you're working on your flexion, pull that knee in and then hold it for like 10 seconds or whatever. And then, relax and repeat, and she said, just really work on that. And I said, well, what about all the strengthening exercises? And she said, the strength will come. And so I thought, okay, so I feel like I've just been told that all I need to do is work on flexion and extension, and who cares about all the other stuff, because it will come. That was kind of my takeaway from that. So then after that, I thought about the whole thing with the cane, and her saying, she felt like I did better without the cane. So I gave up the cane, sometime between week 6 and 7, and I don't remember exactly, but I quit using the cane. But I sure found that as soon as I stopped using that cane, I could not walk without a limp. I just couldn't. I couldn't not limp. And,
Okay.
I limped for a long time before surgery. Maybe a lot of you did not. I did. I limped for a long time before surgery, and I was told that really messes with your brain. So I'd been putting my weight on my right leg for so long that my brain now thinks that is my center. And so I'm having to reteach my brain that this is my center, equal between the two. So anyways, I decided that I would start using the cane again. And then at some point in there, I think it was pretty close to 8 weeks. And I went in the day before my 8 week. Jump in here if you feel like I'm forgetting anything or need to say something. You're being so quiet. You okay?
Yeah.
Okay. At my 8 week physical therapy, well, I was a day before 8 weeks when I had a physical therapy at the clinic. I measured at 128 and 0. So I was pretty proud of myself for that, because I hadn't been to PT for 2 weeks, and I got from 128 to 128 on my own. And so I was very proud of myself for that, and they were really happy with that. But once again, as with every other PT session, I was so sore and in pain after that session, and once again it like set me back, where I just felt like I couldn't do anything now. I couldn't take a couple of steps, up the steps or whatever, because I just was so sore after that PT session. So at 8 weeks and 3 days, I decided I was backing off of PT. I kind of went back to what that nurse practitioner said about work on flexion and strength and extension, and the strength will come. And I thought, okay, that's what I'm going to do, because I was worried that maybe I wouldn't be doing enough. There's that issue where you worry you're not doing enough or you're doing too much. I had concerns that I wasn't doing enough. So, I'm watching these different physical therapists that I've found on YouTube, and I'm kind of making a list of all these different exercises that I think would be really good for me to do. And my list was pretty long. And so by this time, I was doing about an hour and a half of PT twice a day. And it was just a lot. It was just really, really a lot. And I started that at about, I don't know, probably 7.5 weeks. It was just right before that 8 week physical therapy session. I decided I was going to back off. So I went through that list and I just started scratching off all the things that I felt like really hurt and were hard on my knee, like doing squats, and doing lunges and, things like that. So I got rid of all those things, and I pretty much went back to just the basic things that I was given for the very first week. And I was just being kinder to myself and being gentler to myself. And I'd started using the cane again. I'd already started doing that. Then I decided what I was going to do along with that is I was going to try resting more, icing more, walking more. So I would set a timer, and I would lay down and elevate my leg so that my knee was above my heart, and I would ice 20 on, 20 off, 20 on, get up and walk for 10 minutes. Back to the couch, elevate, ice, 20 on, 20 off, 20 on, walk for 10 minutes. I did that all day. And I did that for 3 days. And by that third day, I noticed that I no longer had the snapping in my knee, and I was doing much better, not limping. And I just was overall feeling better. My range of motion was still great. I wasn't having any problems with that. But I did decide to focus more on, obviously still doing flexion and extension, but focus on my glutes and my quads and also on my calves, because I was having a lot of problem with back pain. I would get in bed at night and then my back would just start screaming at me. And so I was trying really hard to work with that. And I found on a couple of different of these physical therapists, which I'm going to link the physical therapist that I really, really like in this video. Well, Dee's going to link them. So by following some of the things that they said about back pain and doing these strengthening exercises, it helped. I mean, my back was killing me. I went back to taking Tylenol 2 to 3 times a day, not only for the snapping in my knee, because I'd been off of it, but anyways, for the snapping in my knee, but for my back at night, because it was just hurting so bad. I also started working more on sleeping on my side, because I did talk to the nurse practitioner that day at the 6-week appointment. I said something about having to sleep with my legs straight. And she said, "Who told you that?" And I went, my physical therapist. She says, "Sleep is the most important thing." She said, "You know what? If you sleep with your leg bent all night, okay, as long as you're comfortable and you sleep. And then in the morning, you can get back to working on that extension." So I just kind of started literally having to practice sleeping on each side, and getting comfortable. Of course, having a pillow in between my knees and everything, and just getting comfortable with that. And it's getting better, and I can sleep on my side for longer now. So, and my sleep is definitely better. And now, since I started backing off on PT and focusing more on those certain strengthening things for my back, I haven't taken any Tylenol. Actually, one morning I got up and I said to Dee, I forgot to take Tylenol last night. And I did great, so I haven't done Tylenol now for a week and a half, maybe, something like that, which is really good. Anyhow, another thing that I've found, and maybe you have found or will find, is that even though this surgery is basically the same from surgeon to surgeon, the after protocol is different. Some surgeons, they send their patients home with the passive motion machine. I can't remember.
Moves your legs
CPM.
forward.
That, you put your foot in it and it moves your leg for you. So some send you home with that. Some don't believe in that. Some send you home with wearing compression hose. Some don't believe in that. Some have you start PT the day after surgery. Some have you start PT at 2 weeks. It's incredible to me.
Some tell you can shower the next day. Some say don't shower for a week.
Thank goodness mine said you can shower the next day. Just let the water run over the dressing. It'll be fine. And it was. So it's incredible to me how different they all are when they do the same thing,
Yeah.
But also you'll find, I guess, depending on your surgeon, depending on whether you do muscle sparing, quad sparing or whatnot, some people will have an incision that goes from 4 inches above their knee to 4 inches below their knee. And, my incision is literally like 5 inches long. It's little. I didn't have staples. Mine was glued and then had the zip line, which was really nice. After the last video, the last update that we did, the comments have just been streaming in, which for me has been awesome. I love reading the comments. My heart breaks for so many people, because as difficult as this recovery has been, I know that so many people have a much worse recovery than what I'm having. And many people have a much better recovery than what I'm having. I just wanted to share with you a few of the comments, and you can go to the last video and go read all those comments because they're there. But, a couple that just really hit me. Peggy Powell says, "Girl, I am with you. I felt like I had gone somewhere that I didn't want to go. Thought the rest of my life was going to be in the most horrific pain. 3 kids and 1 breech, and that was nothing compared to knee replacement. I'm 5 months out and I'm still having trouble, but I'm getting better." 5 months. And so, for me being 9 weeks, I'm like, wow, it makes you feel like I don't have a whole lot of hope if people at 5 months are still in pain and struggling. This gal, Gina, says, I feel like you just told my story. I'm 9 weeks, which is exactly what I am, and nobody knows the trauma that we've been through. I feel like people think I'm a hypochondriac or over exaggerating the pain, but it really is excruciating. I've had 4 babies, C-sections, 12 surgeries in my life, but nothing compares to this pain. I have buyer's remorse and I wish I never did it. I hope that changes down the line. And then she asked about the tourniquet, and she said, I never mentioned that in the video, and that's right. Typically, most surgeons put a tourniquet around the upper portion of your thigh, obviously, so that they can work on your knee and not have blood everywhere, I guess. And a lot of people have severe consequences from that tourniquet. I was bruised. I don't have like nerve pain up there, or I didn't really have a lot of pain from it afterwards. But I have wondered if that's the reason why it's been hard to feel like I can get strength back in that quad, even though it's coming, it's happening. But I just wonder if the tourniquet had something to do with that. So that's another thing to ask your doctor. Are you going to use a tourniquet? What are the chances that it's going to injure me permanently? What are the chances I'm going to have nerve damage? Those are questions that need to be asked. And then Sharon says, I'm so glad I found this video because this is exactly how I feel. I feel like I feel like this is the most devastating experience I've ever been through. I never want to experience it again. You're saying everything that I'm thinking and that I'm keeping inside. I'd much rather have babies than do this. My skin was so sensitive. The bruises on my ankles and on my thighs hurt so bad. I had my knee surgery on February 28th. I needed it in 2015, but it took me this long to get the nerve up. When my knee started hurting so bad, it started to affect my hip strength in my right side. I had to do it. I tried everything to save my knee up to this point. I've decided not to go back to work as a school bus driver. I've filed for disability. I'm going to be devoting my life to see that I do not have the other knee done with taking care of myself. So, the stories typically that you hear that I heard were, the first 2 weeks are the worst. I'm so glad I did it. I wish I would have done it 10 years earlier. It's the best thing I've ever done. But there are so many stories out there like these where people have a really, really bad outcome. And I'm not saying that to scare anybody. I just want, more than anything, I want people to educate yourself, research, ask lots and lots of questions, and make sure that you are so confident in your surgeon. Don't just willy-nilly find whatever surgeon's down the road and closest to you. You find a surgeon that people that have used him and had, success and really liked him. Just really, really prepare yourself, because I've said it many times and it's true. I was not prepared. I did not prepare myself enough for this. Another link that I'm gonna have Dee put in the show notes is to YouTube, a YouTube channel, Dr. Adam Rosen, and I've talked about him before. He's actually an orthopedic surgeon that does knee replacements, and he started a YouTube channel in 2020, when lots of people started YouTube channels, and he was just educating people on knee replacement and helping people that had had it done, and answering questions that people had for him. And I was watching one of his videos the other day, and he mentioned that there are 1 million knee replacements a year. And he said that, which, I was like, wow, that's a huge number. But he was talking about the fact that statistics and different studies have shown that 80% of knee replacement patients are happy with their outcome, and 20% are not happy with their outcome. But he went on to say that doesn't necessarily mean they had a bad outcome, but it's just a lot of it has to do with expectations. He used the analogy, well, not really analogy, but he pointed out that when you take a good, natural, healthy knee and you consider that a 10, it can't get any better than your natural knee at its best. And he said, when we do a knee replacement, the best we can do is an 8. He said, if you have a really good knee replacement, an 8. He said, once in a while, maybe we could get a 9, but it's typically an 8. And he said, so if somebody's getting ready to have knee replacement, and let's say their pain and their inability to do activities and whatever is at a 7, and then they get knee replacement, which takes them to an 8, he said, typically those people are disappointed because they thought they were going to get to a 10. He said, but if somebody comes in and they're their level before surgery is at a 4 and they get to an 8, well, they are twice as much better than they were before. And he said, so they're very happy. So it has a lot to do with expectation. And that made me feel good. I mean, I liked that analogy. I liked hearing him say that. But again, it was one of those things that why don't surgeons tell you that up front?
Right.
Why don't they explain those things? Why don't they ask, what are your expectations? What do you think you're going to get from this?
What do you want? What do you want? What do you want?
And they don't, he didn't in my experience. And even though I'm still very confident in my surgeon, and I think he's a great surgeon, and I really like his resume and all that he's done. But, I just think there's just not enough information put out there. They just don't talk a lot about what's going to happen in recovery and the things that you may or may not deal with. One of the things that if it were not for the Facebook group that I'm on, I never would have heard the term zingers. I found out the other night what a zinger feels like because
They're delicious.
Especially
the raspberry zingers. Love those.
I was sleeping, and I'm actually sleeping better. I've been sleeping better now for a few weeks. I still have, good nights and bad nights, but doing better. I can sleep longer periods of time now. But I woke up 3 times the other night, and I woke up going, oh, because I had an electrical shock shoot from one side of my knee to the other. And then I knew right away what it was. Oh, that's the zinger that everybody's talking about. And that's because in this barbaric surgery that they do, they cut right through your nerves. And nerves want to try to live, and they want to come back, and they want to reconnect, and they want to find new pathways. And when they do that, it's very painful. And so I know a lot of people on the group, they complain that, they have zingers, and typically zingers happen at night for some reason, I guess because you're resting and that's when the body's trying to heal and stuff. But they'll have zingers for a long, long time. I had them that one night, and that was 2 nights ago. I'm terrified that I'm going to have them again, and that, then I'm going to keep having them. So another thing to look out for, there's so much that most people don't know about the surgery, and there are those people that you're going to find that had absolutely no problem. They just breeze through it. They're climbing Mount Everest by week 6, and they never had any pain, and they didn't have much bruising, and they didn't ice, and blah, blah, blah. And Dr. Rosen will tells us on YouTube, on his videos, that he says they are the 1%. They are the 1% of people that just breeze through. And he says they're biologically set up to heal faster and to heal better. And I'm sorry that I'm not in that group, but I'm grateful that I'm not at the other end of the spectrum, the people that just have a bad outcome, and a year and a half, 3 years, even 5 years down the road, still regret that they had that surgery because they've never been able to get out of pain. I feel like I'm on track right now. I'm doing good. I'm not just, running around the house and doing all sorts of things. I vacuumed the other day, and I was so happy I vacuumed.
First time in 8 weeks.
We have a tiny little house, and I vacuumed half of our tiny little house. But I felt really good about that. I will stand at the sink and do dishes, and I still use my shower chair. I still use my toilet seat riser, and I still lay down after doing certain things, things like that, like washing dishes or vacuuming. I have to go lay down. I can't do a lot of things, which is one of the reasons why we can't travel yet, because I can't sit for long periods of time. I've sat here long enough now that my knee is not happy, and I'm ready to lay down. But I think I've covered it. I think you should cover how, the update from the caregiver's perspective.
I will say that if you're going through this, no matter where you are in that stage, if tomorrow's your surgery, if last week was your surgery, if 4 years ago was your surgery, cut yourself some slack. Give yourself a little grace, no matter where you are. Everybody goes at their own pace. The key is you're in it now. Accept it as it comes, and be gentle on yourself for that. And I'll say to the caregiver the same thing. Cut your patient some slack. Give them some grace. And you've got to be the cheerleader when they can't see the light at the end of the tunnel, when they think it's a train. You have to convince them that
Yes. Yes. That's so true.
Right.
I've had a train coming at me all this time, and you've been seeing light.
it is the light at the end of the tunnel. It's not a train light. I mean, you can go out and take a walk, and I'm not going to say cool off. I've never had to do that, but maybe you will have to, because they can't. Just help them through it. And if you have someone like I have this someone who is like her, that just didn't come out right.
I'm interested to see where you're going
If the
with
person
this.
that you're taking care of is like the person that I'm taking care of, you might want to tell them, take it easy. You're doing too much. In my
Mucho take it
opinion,
easy.
Yes.
Hey, listen to me. Hey, mucho take it easy.
3 hours of PT a day
He
was too much.
He kept telling me, I think that's too much.
And I was a big factor in not going back to PT, because anything that is making you better should not make you immediately worse when you're done with it. I'm not a believer in the no pain, no gain, some discomfort.
One of the
maybe, but-
physical therapists that I follow said, if you cannot recover from your PT exercises within an hour, 2 at the most, then you're doing too much. I'm like, well, that's a good goal. I mean, it's nice to have that, that frame of reference, because I mean, it always took me 2 days to recover after PT, after going.
Two 1.5 hour sessions is, if you ever played football in high school and you're doing 2 a days getting ready for football season, it's 2 a days. You are not getting ready for football season.
Because again, I have the mindset that if a little is good, then a lot is a lot better. So if a little gets me better in a year, then a lot's going to get me better in 6 months. And it does not work that way.
Yeah.
It does not work that way. You can't speed up your healing by doing a lot more PT. You can't. You just can't. Not after this kind of a surgery. So
we'll wrap it up with words of wisdom from Dee. No two people are the same. And the days are long, but the years are short. This it's tough as you're going through it, but you will get through it. You will get through it. And you'll look back at it and say, I'm never doing that again. But you'll be able to look back at it while you're walking on the beach now.
I can tell you right now at 9 weeks in, I still will never do this again. I will not do this again. I've found too many physical therapists on YouTube that spend their whole career is all about helping people avoid surgery, even when they're bone on bone, and helping them to be pain-free, even bone on bone. That's the route I'm taking. I won't do this again. Absolutely not. I literally would have to be in a wheelchair, unable to walk, and have no hope of ever walking again unless I did it.
Right.
I suppose then maybe. But I am doing better, and even though I just teared up a little bit, I'm through most of that emotional thing. That's done. I don't feel horribly depressed anymore. And
some days are better than others.
I do. Yeah, I still have my good days and my bad days.
So do I.
But don't we all? So hang in there.
You can do it.
And just, if you need somebody to vent to cry to, I'm here. I'm here because I get it. I get it. I get what you're going through. And I'm going to also share the Facebook group with you. And even though, some of the stories are kind of scary and they scared me at first, but then I learned to realize that I can see them as, wow, I'm not that bad. I have a lot to be thankful for. I've found so much help and so much comfort in that group. And so I will definitely share that.
If we've been any help at all, consider subscribing. If you're already subscribed, thank you. Give us a thumbs up if there's anything you found in here that's useful, and share this video with anybody who might need some encouragement, or to laugh at me, or to see Jimmy's cute face when he climbs up on my lap in the middle of a video.
Thanks so much for watching, guys. Thanks for hanging in there. And we'll give another update at probably about 4 months.
All right, okay.
And hopefully by then the magic will have happened, the switch will have flipped, and we'll be doing all the things.
Climbing trees and playing football. I did use a football reference.
Climbing Mount Everest.
Yeah.
That's the goal.
That's the goal. Mount Everest? Okay.
We're more indoorsy than that.
Oh, yeah. All right, guys. We appreciate you. And we will see you down the road eventually.
Yeah. Bye. Is it okay if I refer to my notes? I mean, I can
It's gonna have to be, isn't
I
it?
can even mention that I'm going to be referring to my notes.
And cue Jimmy.
Camera's over there now, right?
It is. It's on that side.
Okay.
There it is.
How long is it?
32.
That's okay.